Okay, new terms. You'll hear some of these this week as we kind of get started on our next unit. So a disease. I want you to look at the difference between disease and illness. A disease is a condition marked by subjective complaints. What does subjective mean? Subjective. Yeah, it is. We'll talk about this word a lot. Subjective versus objective. Subjective is like kind of like it's in your opinion kind of thing. Like pain is considered a subjective thing. So for me, what doesn't seem very painful for me might seem really painful for the next person. It's kind of different for everybody. That makes sense? Subjective. If I use like my opinion, like let's say, you look like you don't feel good. That would be subjective. Okay? Now, objective information is measurable, something that can be repeated. If I say you look like you don't feel very good, then versus if I check your temperature with a thermometer and it gives me a number, if your temperature is 102, then I'm going to know. That's objective information. Me looking at you and giving my opinion is subjective. Does that make sense? You see the difference in those? So, disease is a condition marked by subjective complaints, a specific history, and diagnostic findings. It means it's kind of has a pattern to it, right? Like hypertension is a disease. Hypertension is high blood pressure. Okay, so how am I going to know if somebody has high blood pressure? How am I going to know? You check it, right? It's over 135, over 90 usually is what they're considered hypertensive. So that's objective. That's a diagnostic finding. If I check their blood pressure 3 times and it's always that high, you can pretty well say, okay, they have hypertension. Has a specific look to it. That's what those diagnostic findings are. That's like vital signs, or if they do a lab, let's say your sodium, level is too high, and they check it with they go check your blood level, your sodium levels in your blood. That would be an objective, a diagnostic finding. It's something that they use to diagnose you with something. An X-ray is a diagnostic tool, right? That's how you figure out if you've broken something. Okay, it's usually tangible or measurable. It has some measurable things to it. Illness is a condition marked by subjective complaints and a history that is individual or personal. Okay, so if I get a cold, I would think of that more of an illness. It might look different for me. I might get a runny nose and I might sneeze. You might cough and have drainage. You know what I'm saying? It's more subjective. It doesn't have necessarily something that you can measure. Sometimes you get fever, but sometimes you don't. Okay, so that's the main thing. Disease is measurable. It's got some specific diagnostic findings versus an illness that's usually kind of different for everybody. Okay, chronic versus acute. These are 2 terms that mean opposite things. Chronic is a long-term or disease that might progress. Doesn't necessarily mean that it progresses slowly. It can, but they're going to have it long-term. It's something that you don't get rid of. You've got disease is a chronic disease. It's not something that's ever cured, right? It's just you continually treat it. Chronic. A lot of people have chronic pain or all kinds of things, but you'll hear that word. Acute is something that's happening right then, like, for example, appendicitis. A lot of times you'll hear it as acute appendicitis. Doesn't mean that it's acute. But it does mean that it comes on all of a sudden, right? They get it right then. It's really severe. The pain's severe. All of a sudden, all of the symptoms appear around the same time, and it's like, it happens very quickly, and usually even the bout with whatever they're dealing with is short. So, people can have chronic diseases and have acute exacerbations of it. For example, asthma. Okay, that's a chronic disease. It's something that it's not like you just get asthma once and then you never have it again, right? You have asthma for long periods of time. Sometimes people grow out of it, but not always. So you have chronic asthma, you might have acute exacerbations. What that means is that, you may always have the asthma, but every now and then it gets worse, right? They get sick or it gets worse for a short period of time. An exacerbation is just like a worsening of a long-term disease for a short period of time. So that exacerbation means maybe they got a viral illness, they got a cold, but they have asthma. That's going to cause their asthma to exacerbate. It's going to make it get worse for that period of time while they're fighting off that cold. Does that make sense? Okay. Lots of new words in there. Okay, syndrome. This is a group of symptoms, signs, lab findings, or physiological disturbances that are linked by a common history. A lot of times syndromes, people a lot of times are born with syndromes, and they usually have several different aspects to them. There's usually several different maybe symptoms that you see and so forth. And you can have there's other syndromes that you're not necessarily born with, but it's usually a mixture of different issues all in one. That makes sense? So, you think about what we hear a lot about is Down syndrome, right? So that's an example of there's usually multiple issues involved. But most people with Down syndrome have specific facial features, right? Their ears look a little bit different. The bridge of their nose is a little bit different, and that's part of that syndrome. They have kind of the same common effects in different areas. Usually, heart problems are associated with Down syndrome, and there's lots of different issues in different systems.
Caitlin, come to the office, please.
Okay. All right, like number 6, invasive. And this has two meanings, but they're similar, related. So one can mean tending to spread, or 2, it can be used to describe a procedure in which the body is penetrated or entered. So, for example, tending to spread would mean like a disease, like someone has cancer. Let's say they had a melanoma. That's a skin cancer, but it's become invasive. That means it's affected more than just their skin. Maybe it's started to affect their kidneys or their lymph nodes or their spine or whatever else. That makes sense. It's invasive. It tends to spread. It moves in. It's kind of like it gets in your space, if you want to think of it that way. Invasive. So the second meaning here, used to describe a procedure in which the body is entered, would be like an injection, like a shot. That would be considered invasive. It's more invasive than, like taking your temperature, taking a medication by mouth, right? It's more invasive. I always think about this. There's it's an old commercial, I don't even know if it plays anymore. I think it was Texas Health Resources, or maybe it was a Baylor commercial out of Dallas, where these 2 old men have been swimming, and they're talking that they're like comparing surgical scars. Have you ever seen that commercial? And one of them, they talk about it, them going through their nose. Like, I had brain surgery and through my nose. I'll look it up in a minute and I'll show y'all. Anyways, invasive that was talking about a minimally invasive surgery. So you can see where if they do a surgery in your brain, this is kind of like the surgery my dad had. They went through his nose to remove that pituitary tumor. And was somebody talking about this in here the other day? Anyway, they actually could go back through the sinuses to get to the pituitary gland. It's like right in the middle of your head, pituitary gland is. So that is less invasive than them opening up skull and trying to go in through that direction. See what I'm saying? That would be less invasive because they're not opening up as much. They're not doing this major surgery through the brain and things like that. So you'll hear that word a lot, invasive, but pretty commonly used word. And then preventive, we just had that on our insurance quiz, so we'll get that one again. We know what that means now, right? To prevent the occurrence of disease or avoid it. All right, the rest of these are abbreviations, a few extra abbreviations this week than we had last week. DX is diagnosis. What is a diagnosis? Like what you're given. Yeah, right. That's kind of what they say, that your disease or your illness is. That's your diagnosis. That's what they put it into terms, basically. Good. So DX is diagnosis. PPO, we already know these, Preferred Provider Organization. HMO is Health Maintenance Organization. Okay, this next one's You'll see these all year long too. But left can be abbreviated. You can just put L. Sometimes people put LT, or sometimes they put L with a circle around it. Okay, so any of that can mean left, like left arm, left leg. You can use it however you choose to. Okay, and the same with right. R, RT, or it can be R with the circle around it. You can draw your circle on there if you want to. I just couldn't do that on my computer. Okay, the next one is CDC, the Center for Disease Control. So different things we talked about a little bit last week. CDC, WHO is the World Health Organization, and then FDA is the Food and Drug Administration. What's the difference in the jobs, do you think, between the CDC and the FDA? What does it sound like? What do you think the FDA is in charge of? Food and drugs. Food and drugs, good. What do you think are some things that might be included in that?
You always hear like on TV, like FDA approval.
Okay, yeah, exactly. So you hear about FDA approval. That's because the FDA has to approve drugs that are going into the market, right? So, and that's a long process. A lot of times by the time drugs are actually available to the public, they've already been around for 10 years. They just had to go through all this testing and research and everything else that comes along with it, manufacturing. So yeah, FDA is the one that does that. Sure. Food is another, with that being food and drug, that would be, I mean, they have to approve food items as well that are a little bit like, I think about like formula and things like that that are kind of formula. I mean, that's pretty, that would be a major like chemical, what's the word I'm looking for? It'd just be intense to make formula. I mean, there's so many things that have to go into it for it to be the exact right amount that babies need and things like that. I don't know why that makes me think of it, but you know, that's a big task, is to approve what we eat and what we take as far as medication goes. Now, the CDC is, you know, aims to prevent the spread of diseases and to educate on diseases. So they're the ones that would determine, if I'm going to go to Africa and I want to know what shots I need to take before I go, I'm going to go to the CDC website and look it up and talk about travel and things like that. Okay, so they're more disease-related versus the FDA that is related to, like you said, approving food and drugs and researching it. And if people have issues, you know, if there's something comes up and there's lots of people getting sick from one drug or having lots of side effects, they're going to be the ones to investigate that. There used to be these commercials for, it was like a diet pill. Used to see all the time that, you know, people are like, oh, if you've taken this, they'll have like longer commercials for it. So they're probably the ones who do investigations on things like that. So that's your new payday terms. Keep in mind, you'll have 5 from last week as well. So your payday quiz Friday will have 20 questions on it. So I have 5, it could be probably a mixture of word terms and abbreviations on it. So make sure you're looking over that. Okay, let's review real quick we're going to have the test over this first unit tomorrow. I'll give you guys some time to study today. Make sure you study tonight. So that's why I gave you back your insurance quiz. That can be on there. If you look on here, it tells you what else. If you look on Wednesday where it talks about the test, it tells you exactly what to study. So how available is healthcare? That's where we talked about the different agencies. We talked about the VA and talked about different healthcare agencies. The insurance PowerPoint, most of those terms are on here, but make sure you look over that. Your quiz and then payday terms can be on there too. Let's kind of go over a few things. All right, what's the difference? What do you call somebody who is a patient in a nursing home, Nayeli. Resident, good. What is a provider? Some of these are old Payday terms. JC. What's a provider? Do what? It's anybody who provides a service to someone. So, for example, could be like a physician could be considered a provider, an X-ray technologist could be considered a provider, a company could be considered a provider, pharmacy could be considered a provider, just anybody who offers some kind of healthcare service. Reagan, what is hospice?
Care is given when a patient has a prognosis of death in the near future.
Right. So somebody who's been given, prognosis of death in the near future, a lot of times they'll put them on hospice care. It's up to the patient, and it's not something that's required, but that's always an option. It's just care that's received at the end of life to keep them comfortable, to provide whatever they need, for that time period. Angelica, what is an example of a specialized hospital or specialized health agency? Just an example. Okay. Okay. Anybody else? It's considered specialized. We're talking about a health facility or a
like specialized in cancer or
right. Okay, so they might specialize in cancer. What are some other specialties we see with hospitals or clinics or whatever else?
Muscles.
Do what?
Supposed to do like muscles and.
Right, orthopedic. Okay, might be muscle or joint related, bone related.
Don't you have like your pediatrics or your people, your only older people?
Right, pediatrics or geriatrics for sure. Those can be considered specialties. So that's all that is. There's certain places that have a specific specialty that they focus on. Taylor, what is the difference in Medicare and Medicaid?
Medicaid, and it's for like people that one of them for old people and then one of them for people that need one. I'll go with them.
Medicare is for the 65 or older, okay? And I just always think about that, older people tend to need more care, if you want to remember it that way. So you might remember. And Medicaid is income related. So this one is related to income, okay? Madison, what is the VA, who does the VA service? What does the VA stand for?
Veterans and nutrition.
So who does the VA service to the veterans, right? So people who have been in active military duty. Andre, what are some examples of long-term facilities? Long-term care, people who do long-term care. What are some examples of that? One is like a nursing home.
Okay, like basically like the type of
Okay.
things that have to be on.
No. Just a facility. So nursing home or like a rehab would be long-term. Do what? Yeah, rehabilitation. Assisted living would be another example. Somewhere that people would stay for long because they need care for a longer period of time. Okay. It's not just like your standard hospital. You go in and stay for a few days and then you go home. Long term, they need care long term. Caitlin, what's the difference in an HMO and a PPO? What does PPO stand for? Okay, so help. What does PPO stand for? Preferred Provider Organization, and HMO stands for Health Maintenance Organization. So what's the difference in the two of those?
Prefer to have.
Right. Okay. The PPO, you have more control over your own health care, right? With Health Maintenance Organization, they manage your care for you. Always think of that M in there, manage. They're the ones that manage it. They're the ones that they really have to approve everything. They're the ones who have to send you to other places and so forth. Okay, good. Madison, what does preventive mean? Just think about prevent. What does it mean?
If you get like a shot or something, like it will you like.
Right, okay, it's something that hopefully keeps you from getting sick. And that's a good example. A flu shot is a perfect example. Preventive care, right? In hopes you take that shot in hopes that you won't get the flu. Good. Andre, what is deductible?
What must be paid before full benefits proceed?
Right. What must be paid before full benefits are received? What does that mean?
You have to pay before you can get into the budget.
Right. But it's like kind of an upfront fee. What you have to pay before they're really going to kick in what the part that the insurance pays.
If they're in the office, you think it would do like you like take this out there.
Like a deduction, yeah. It does kind of deduct off of your final cost, I guess, but it doesn't really deduct for you. You don't have to pay it. All right, Angelica. What do we say the CDC is? What does it stand for? Okay. Center for Disease Control. So what do they do? Just think about it. Center for Disease Control. Yeah, that's one of the major things they do, right? They help prevent disease. They're trying to prevent the spread of disease. If there needs like the Ebola outbreak last year, okay, CDC, that was all, CDC was the one trying to prevent that. They came into a hospital in Dallas, what was it, Presbyterian? They had the nurse there. And, they were the ones who did all the quarantining, all of that kind of stuff. So they try to prevent the spread of disease. Prevent and control the spread, everything else. Talked about Medicare, Medicaid. Talked about deductible. Reagan, what about whole life insurance versus term life insurance?
Life is a policy that allows the holder of the policy to draw on the insurance as a pension, as well as having money go to a beneficiary, which is a specific amount of money that will be paid.
Okay, so what's the difference?
Like term life insurance is the money that will be paid to a specific amount that will be paid to the beneficiary, and the whole life is a policy that allows the holder to be in charge of the beneficiary.
Right. Well, whole life insurance basically kind of functions kind of like a bank account, where the money that I put in, I could take back out if I wanted to. A term life insurance doesn't work like that. The money I put into it is just there. That's the end of it for me. But if I died, somebody else would get that money. And they would do the same thing with whole, but that whole life insurance is like, if I put $50 in every month, and 6 months from now I need a couple $100 to do something, I could go in and draw out that $200. Term life insurance, you can't do that. It's just, you just pay for it, and if you die, they get it, and that's the end of it. You don't receive that money back. Okay, can we see the difference? Taylor, what is out of pocket mean? Your out of pocket expenses. See that. Right? It's what you pay comes out of your pocket. So things that you pay. What are some different, what parts of the insurance that we talked about are considered in that out of pocket expenses? One that Andre talked about a while ago. What? No. Here, I mean, deductible. What else? Not your premiums? No, not your premiums aren't considered out of pocket. That's just the cost of insurance. I mean, it does come out of your pocket. What do you pay at the doctor's office? You go and they say, okay, you owe $25 today. What is that? Do it. It's part of your out of pocket. What's the term for that? They say, okay, on your insurance card, it says you have a $25, set for me, copay. Okay? So copays are considered an out of pocket expense. What's the other one? The percentage. Co-insurance. Okay, so all that's included in your out of pocket expenses too. What are examples of some supplemental insurances? What's one example of supplemental insurance? Or supplemental is in addition to your health insurance. So what are some other insurances you take out? I'll give you one example. One is vision. Another example. Do it. Dental. Good. Life insurance. Disability insurance. All of those are examples. JC, what does EMS stand for? Good. Naomi, what's the abbreviation for as needed? PRN. You know, wondering why you might use that? Why do you use that as needed? And let's say I give you a medicine. Let's say you had some pain. Okay? And I'm going to tell you IBU is the abbreviation for ibuprofen. Okay, so I want you to take 200 milligrams. We'll learn Q pretty soon. Q 6 hours. That's what Q means every. We'll have that probably a week, so I'll be in abbreviation. Every 6 hours, repeating RNA. The way that you read this, and you'll be able to, by the end of the year, you're going to be able to read all of this. Ibuprofen, 200 milligrams, that's usually one tablet of ibuprofen. Every 6 hours, as needed for, what does that mean? If you're hurting, you can take ibuprofen every 6 hours as needed. Right? So that's an example of when you use CPR. And it's used very often. What's the word for walking? For walking. Ambulate. Good. Okay. So make sure that you are prepared tomorrow for the test to talk about your agency that you spoke of this week. So you're not going to have to list out a whole bunch of stuff, but you need to be prepared to you might look over your notes or think about it, think that through. And that is